I'm Dr. Dylan Seitz, and I'm currently the postdoctoral fellow at Indiana University School of Medicine. I just recently completed my internship at the University of Missouri in the neuropsychology clinic. At the neuropsych clinic, we do both bariatric evaluations for pre-surgery, as well as our neuropsychological evaluations. And so we are looking to evaluate people's thinking skills, so things like memory, attention, and language. And we do that by paper pencil testing to get the best idea of how someone's brain is functioning at that time. It really affected us in a number of ways. I think the first one that comes to mind is our patient population. We serve a lot of patients 65 plus, and as we know with the virus, that's one of the most vulnerable groups. We pretty much ceased in-person evaluations immediately, and then we had a day where we disinfected the clinic, but just really wanted to put our patients first. The second one being our evaluations are really tough to do over a Zoom format, and it really hadn't been done before. We do a lot of paper pencil testing. We're interacting face-to-face with the patient, making observations about how they're doing some of these tests. So we had to really form a brain trust and figure out how to adapt this to something like Zoom. A lot of my peers and colleagues come from clinics that just stop services completely until another date. We were really able to adapt and do this over Zoom. As an intern, it's really important that we get a certain amount of clinical hours. And so I think there was that fear that, will I be able to go on to the next step? Because we were able to shift and adapt so quickly, that fear was definitely lessened for me. We've been working on some interdisciplinary research projects, particularly with physical therapy. We have a pretty good relationship with them just because we share a lot of the same patients. We're managing concussions, traumatic brain injury. So we were having a Zoom research meeting one of these days, and the comment came up that, beyond concussion and all these things, we're just noticing so much anxiety from patients and also patients' family members. So in my rotations at doing psychotherapy at primary care, a lot of my patients presented with the same kind of anxiety. That was pretty much what all my sessions were about. And there was a really great resource from Dr. Russ Harris, who does ACT therapy, and he specializes in different ways to cope and develop mental flexibility in this time. And it's a really easy handout to be able to send patients. And so we sent it over to their department as just something that they could provide their patients, just a quick solution-focused way to manage some of the stress. Absolutely. So I think when you are in a pandemic or a crisis like this, you have to adapt and kind of revolutionize your service. And so if anything were to happen like this again, we would be ready. We have a way to do this now over Zoom. The other piece that I really thought was a big silver lining was patient accessibility. So we service a lot of areas in Missouri. I've had people drive as far as from Iowa for one of these evaluations. Also for our bariatric patients, where sometimes mobility is a concern due to physical limitations, we had a lot of patients that just couldn't ambulate safely in our clinic or would choose not to. And so we would have a lot of no-shows. To be able to offer that to patients that wouldn't have to make a 3 to 4 hour drive, or if they're just don't have the resources to be able to come to the clinic, being able to provide them an altered Zoom experience or service is definitely a benefit to both us and the patient population. In the long run, we're going to be able to serve even more patients because of how we were able to adapt and refine our service.